Missing U.S. physician cannabis science education. Medical cannabis in the U.S. today. The disconnect in U.S. medical schools. See how plus what physicians know and how to deliver safe and quality patient care. Founder and CEO of CannabizMD from the United States of America, Jacquie Cohen Roth.
Good day and good evening, esteemed colleagues. I'm delighted to be here at this groundbreaking event. Thank you to Jacquie Young for inviting me to participate and speak to you about the void of cannabis science education for U.S. physicians. That will be the topic of my discussion at this moment. Cannabis has, as you most likely have heard prior to my conversation with you right now, is that cannabis has a very long history in the world, certainly. Dates back 5,000 years as a clinical treatment. And it was listed in the U.S. state's pharmacopoeia from 1850 to 1940, where it was introduced in the U.S. by a Dr. O'Shaughnessy, who brought it forth into quote unquote modern day medicine at that time. He was a physician out of the UK. Where it stands today, in November of 1996, well, going back, actually, cannabis was outlawed in the U.S. in 1936. And was what is very critical for everyone to recognize, certainly in the U.S., and it had impact across the globe, was the laws that which now regulate the cannabis industry and make it federally illegal in the U.S. are actually based on racial prejudice, again, going back to the 1930s. It wasn't until 1996 that Proposition 215, or the Compassionate Use Care Act of 1996 in California, California became the first U.S. state permitting the use of cannabis despite the federal prohibition. Again, in the U.S., cannabis is a Schedule I, meaning that it has no merit as a medicine for any clinical use and is actually considered a dangerous drug. In November 2020, we refer to it as the green wave in the U.S., where last week, it was an exciting week in the cannabis industry in the U.S., where there were 5 states that either added to their existing medical cannabis program, or they added to the existing program by adding on or becoming an adult use state, or also as known as a recreational state. And be mindful that this is not an immediate act, that it does take time for the respective markets to catch up and regulations per that state to be put in place for, most importantly, patient safety. So there are 43 U.S. states. Washington, D.C. have a medical cannabis program. What's of significant note in the U.S., South Dakota, which is one of the most conservative political states in the U.S., voted simultaneously to have both a medical program and an adult use, again, recreational program. There are an estimated 22 million people in the U.S. that have access to medical cannabis and consume cannabis without truly understanding the risks and true medical benefits. What's of significance in 2017, there's a landmark U.S. study that was published by the National Academies of Sciences, Engineering, and Medicine, which reported that there is conclusive or substantial evidence that herbal cannabis, as we know it as, whether it be flower or a derivative of that product, or a synthetic medicine like dronabinol, are effective for use of treatment of pain, as well as chemotherapy-induced nausea, vomiting, and or for spasticity associated with multiple sclerosis. So again, the data, these numbers are very powerful, where 230 million Americans live in states with a legalized medical or adult use, representing 70% of the US population. This is 1 in 3 Americans have access to cannabis, whether again it's in a medical program or in a recreational program. And here's where the disconnect is that out of the 154 medical schools in the US, only 9% of them include content specific to the science of cannabis. This data was first reported from Washington University, a renowned US medical school. What is critically important in recognizing is that the physicians do not have the education to understand. Firstly, is that although medical cannabis or cannabis cannot kill somebody, it's physiologically impossible to die from cannabis. And my colleagues, most likely throughout this conference, will explain why that is, but I'm just going to share just a bit of information about that. And again, it is physically impossible to die from cannabis alone. That said, however, it does present some possible dangers or side effects that if somebody is, for example, on a drug thinner like warfarin, where that does present a problem as the warfarin is metabolized in the human body, going through what is referred to as first pass metabolism in the liver and competing with and how medical cannabis or cannabis is metabolized in the body. This can actually increase or decrease the traditional pharmaceutical product that has been prescribed by a physician, or a traditional pharmaceutical product that has been prescribed by a physician, and difference being with the word recommended is how physicians or licensed and certified medical cannabis providers are recommending the use of medical cannabis to patients. Here's what and how physicians know. This is a quote from a physician who's based in Washington, D.C., a primary care physician. Some of the best information out there is on dispensary websites, but that's not the source I'd like to rely on as a physician. Be mindful of, and so that you understand again that cannabis is available only for purchase at a medical dispensary. Each state has its own regulations that guide the sale of medical cannabis and the qualifications of a provider that is permitted to recommend medical cannabis. This may be an MD, a DO, doctor of osteopathic medicine, an advanced practice nurse, etc. But again, each state having its own set of regulations on the qualifying conditions to have medical cannabis recommended. Another quote of the significance of delivery of safe and quality patient care is what we're all focused on, those of us who are professionals in the medical cannabis lane. As Dr. Rachel Knox, a renowned physician and endocannabinologist, as she refers herself to be, it is our job to have a command over the pathophysiology of the endocannabinoid system and the command over the pharmacology of cannabis, so that when we're sitting down with a patient, we can have an intelligent conversation with them and begin to apply the science of cannabis very accurately to the condition that the patient is seeing us to address. So being mindful is that there remains a stigma to medical cannabis still to this day, where because of Schedule 1, again, the laws that are guiding the use and prohibiting actually much of the use of medical cannabis is that the physicians again have not been trained. Patients are embarrassed to ask their physicians or tell their physicians and share that they are using cannabis, whether again as a medical patient or that they're using it recreationally. And again, this can be dangerous. There are some side effects. Again, this is mostly patients and consumers of cannabis are not going to be subjected to some of these side effects, but they can have negative side effects. For example, if an individual is predisposed to mental health disease, and that there are studies that do support that the use of medical cannabis can actually exacerbate or cause to trigger what may be an underlying psychosis. And again, I can't say enough how critically important it is that U.S. physicians are trained in this, and again, they are not. So I'd like to stress that this is just not in the United States. Drug policies are changing across the globe. This green wave that has started in the United States is quickly rolling across the world. From my understanding of what I've heard from my colleagues in Thailand is that there is initiative underway to legalize medical cannabis in some form in Thailand. I believe it is in maybe 2022. New programs are launching across the globe, but physicians, they are generally the agents that are legally authorized to recommend medical cannabis for patients. And in some countries, they are directly certifying it. They must be educated on cannabis science to ensure patient safety. Some information about myself, but I do have the opportunity, and I'd like to stop sharing my screen to open this up for a less formalized presentation. I welcome questions from the guests that are listening. Okay. I'd like to underscore that again, that each state in the U.S. has a different set of.
Sorry,
Yeah.
Sorry about that. We do have some questions. So,
okay, sure.
We had a counterpart in Canada speaking about some things, as well as in Rio de Janeiro, about the application of and success rates compared to profitability in regards to conventional medicine and using CBD and other cannabis treatments to treat like epilepsy and stuff like that. What is your recommendation in regards to replacing conventional medicine with cannabis or CBD?
Okay. Yeah, actually there's it's actually a story that's based in the UK. The mothers that I am finding are the most powerful advocates to ensure access to medical cannabis. There's the story of Charlotte Teague in the US who sadly died, I believe it was at age 14, early spring. Hannah Deacon, who is based in the UK, a mom who her son has a very rare form of epilepsy, and I skipped over actually is that Charlotte, she had a very rare form of epilepsy. So yeah, studies do indicate particularly that CBD is very efficacious in treating epilepsy, but absolutely without the engagement of a neurologist and a physician who is a champion regarding the use of medical cannabis, I would not discontinue the use of traditional pharmaceutical products alongside the medical cannabis. That said, if there is very careful and monitored treatment and a protocol where a physician is carefully starting off a patient on the proper dosing, there has been shown that there can be either a decrease in the traditional pharmaceutical product and as that being is transitioning over to CBD, or as in the case of Hannah Deacon's son, Alfie, is that they are using CBD as an adjunctive therapy to traditional pharmaceutical products. So yeah, in no way would I ever present that medical cannabis is a panacea, that it's going to solve and treat diseases, but that it is one that should be considered as an adjunctive therapy with far less side effects.
Wonderful. And that ties directly back into Dr. Cardosa in Rio de Janeiro, and also another doctor we interviewed last night in South Korea with their patients and her kid who has autism. And the case studies where some of these kids have 3 to 5 different conventional medications, and then after increasing dosage up to 200 milligrams of CBD, they end up only needing 1 conventional medication. All of their secondary characteristics in regards to aggression and other negative behaviors start to really decline or completely go away. Do you see CBD and cannabis potentially replacing most conventional medicines in the long term as they are introduced into the market in America?
I would not go on record as saying that they're going to replace. Again, that I would consider and encourage patients, mothers, patients, caregivers to not be ashamed to share with their family physician or their neurologist, their specialist, is that they would like to consider medical cannabis. Again, the side effects are minimal. For example, the story that I keep referring back to is Alfie. Alfie started presenting with hundreds of seizures a day at age 8 months. It wasn't until age 5 where he received a diagnosis of, again, a significant rare form of epilepsy. He did have, that family did have a champion, Dr. Michael Barnes, again, who is based in the UK, who encouraged the family to actually become what is known as a medical refugee, where they move to a country, or in the US to another state where they have access. So again, I just be mindful of medical cannabis as use of its own. But when you consider, there's a lot of conversation out there about how cannabis is a gateway drug. If kids have access, juveniles have access to cannabis, that it's going to impair their IQ, their intelligence level. It's going to kick off psychosis. That goes back to, the scary movies of the 1930s. But you think about...
I'm so glad you segued into that, because that's touching on the next question. So my next question was going to ask you basically what you would like to see the medical community do more of in regards to educating the public as well as patients in regards to overcoming these stigmas as well as the benefits of cannabis.
Well, the first thing that we have to do is that the physicians have to become educated. They don't know enough. That I hear regularly that the physicians are hearing, like those quotes that I shared during my presentation, that they are asking the patients, tell me where you're getting your, tell me about your cannabis use, where you're getting it, how are you using it? And that is, we have to shift that paradigm. Is that it should be that the physician has the information on hand to share with the patient, and then what's critical importance then is that that patient is well armed with information when they leave that physician and that conversation with the physician. They've moved to they have a recommendation, again, at the US. Some countries, the word is actually prescribed, but in the US, when a patient moves on to the dispensary to actually make the purchase of cannabis, they're being seen frequently by somebody who does not have any clinical training, or may have alternative methods or intentions, rather, to present another product that the physician would have recommended or did recommend. What I want to step back for that question that where you had asked me previously about the use of CBD on epilepsy, for example, is that, back to Alfie, my understanding is the traditional course of treatment when a child presents in an emergency room setting is that they are put on IV steroids, and Anybody who has had any personal experience with steroids understands it is a really unpleasant feeling. And we don't know the side effects, of the steroids on yet a developing brain. That's not clear cut versus what are the long-term effects on a juvenile brain with medical cannabis.
Excellent. Thank you so much for your time and all your valuable information. We look forward to hearing more from you in tonight's panel discussions.
Thank you.
Thank you.